Now today we'll be discussing about a lot of questions, queries, doubts regarding retained products of conception, which we sometimes call as RPOCs. Now, when a woman opt for termination of pregnancy, sometimes they go for expectant management, sometimes medical management, sometimes surgical management. However, not all the procedures will always be successful. Sometimes there might be some part of your conception that might be left behind in the uterine cavity, which can also happen after a normal delivery or a cesarean section. And that's when we call retained products of conception in the uterine cavity. So, retained products of conception and retained placenta. Well, retained product of conception considers a lot of things. It includes your retained placenta, some amount of blood tissue, blood clots, fetal tissue, decidua. All of these terms comes under a broad term which we say retained products of conception. Whereas when we talk about retained placenta, it specifically targets the placenta, which sometimes is left behind after a normal delivery or after a cesarean section. Now, why this retained product of conception happens? What are the causes? So, the most important cause is sometimes the patient is having a spontaneous abortion. Patient ends up bleeding for 3 to 4 days, and the patient thinks that okay, everything is being clear, I need not to go to the doctor, everything is fine, and she continues with her normal life activities. But what happens in some cases, there might be some product which is left behind. It might not land up with bleeding, but there can be some infection in the later stage, or in the later stage she can present with excess bleeding. So that is one cause for retained product of conception. The second cause is if the patient has taken a medical termination, and we usually advise the patient to come after 2 weeks so that we do an examination, we repeat a scan to make sure that everything has been evacuated. But due to the loss of follow-up, because the patient thinks that I bled for 3-4 days, everything is clear, there is no need to go back. However, in some cases, 2 to 3% cases, there might be some product which is left behind despite of taking a medical termination. And the third cause is if we do a surgical evacuation also, and in those cases also, sometimes there might be some amount of product which is left behind, and that again presents with other symptoms like bleeding, abdominal pain, etc. Now, symptoms which regarding retained products of conception. So the most common symptom, in fact, I always counsel my patient who's going for an expectant management, medical management, or even for a surgical evacuation, that in case you land up with excess bleeding, there's passage of clots, then please report back to me, because that is a most common symptom associated with retained products of conception. The other symptoms are abdominal pain, some cramp, fever, chills, which are the signs of severe infection or that the patient might land up with sepsis. So if you have any of these symptoms, then please report back to your doctor. Now, regarding the diagnosis of retained products of conception, so whenever a patient walks in my OPD with a history of amenorrhea, let's say for a month or so, and maybe they've taken a medical termination or they had a spontaneous abortion, and then they land up with excess bleeding, passage of clots, weakness. So the first thing that I do is to do an examination, because it becomes very important. I'll make the patient lie down and I'll do a pelvic examination to see if the cervical os, the opening is open, if there are certain clots which are coming out, to assess how much is the bleeding, to rule out other local causes for bleeding. So that becomes very important, and after that we assess the size of the uterus and we get an idea that there might be a possibility of some retained products inside the uterine cavity. The sure way of knowing retained products of conception is an ultrasound. So after doing my general physical examination, knowing the temperature of the patient, the pulse rate, the heart rate, the pelvic examination, the per abdominal examination, I'll advise the patient to go for an ultrasound to assess the size of a uterine cavity, to know if there's any blood clots, if there's any vascularity around the clots, and how much is the collection. So that is a sure way of knowing if you have a retained products of conception. Now, how do we treat retained products of conception? It has to be individualized. We do a scan, we'll get to know how much is the collection, if there is a vascularity or not, and depending on that, either I'll tell the patient to go for expectant management because the amount of collection is minimal and it will come out on its own, or I'll ask the patient to go for a medical termination. Or if there is too much of products, the patient is bleeding very heavily, then sometimes we have to do a surgical evacuation also. Now, we all are worried about fertility. So one important question every patient asks me is, will I still be able to have children after a surgical evacuation of my retained products of conception, or if I go for surgical evacuation after incomplete abortion? Well, the answer is yes. The procedure has to be done very gently. You have to be very gentle while doing the suction evacuation of the products if you're going for surgical management. And if you're very vigilant and you do very gentle evacuation, then there won't be any issue with your fertility. Same goes with medical termination. It will not hamper your future fertility.